LSN, the #1 news station with Sarah and Lee.
Good afternoon, and this is LSN, the #1 news station you can always count on.
Today we will be discussing one of the world's most dangerous epidemic, tuberculosis or TB. It has been described as the #1 killer. Last year it was reported that 8,000 people died per day, an increase from past years.
This is one of the most shocking aspects of TB. Unlike most diseases, the infection rate has increased. While anyone can contract the disease, certain people are more prone to becoming TB positive. People who live in developing countries have a higher rate of obtaining the disease.
This is because of usually unsanitary and crowded conditions. In addition, many developing countries, especially in sub-Saharan Africa, also have high rates of AIDS and HIV. Thus, because AIDS and HIV causes the immune system to weaken, people can become infected with TB much easier.
Many people who live in developing countries do not have easy access to adequate health care as well. Other people at risk include the homeless, once again because of unsanitary conditions, and individuals who are in the same vicinity as people who hold the disease.
So tuberculosis is actually caused by a bacteria and is an airborne disease.
Yes, the bacteria is called Mycobacterium tuberculosis.
The strange thing is that although TB is such a huge killer, it is easily preventable. The immune system is able to form a scar tissue around the bacteria. If the patient's body is able to locate the disease, then they are not contagious. This stage is called latent TB.
Is it actually true that the scar tissue in your lymph nodes can harden from TB?
Yes, TB causes them to harden due to calcification, or loss of calcium in the bloodstream.
When your body first obtains the bacteria, your body is threatened by another health threat, TB goes into active mode. During active mode, you experience all the symptoms and you are contagious. This is where the disease keeps multiplying and eventually will form a hole in your lung.
TB first affects your lungs, but eventually can spread to one's kidneys, bones, spinal cord, and lining of the brain.
I had a friend who had TB, and the symptoms he generally experienced were weight loss, fatigue, and fever. Since these are such common symptoms, he did not go see a doctor.
Yeah.
When his case got more advanced, he began to regurgitate blood and sputum. Eventually he was fine, but that's the biggest problem involving TB. TB actually shouldn't be as big as a problem, seeing as though TB drugs have been around for nearly 50 years that are very well able to kill the disease.
I actually read this great article about this new issue arising of drug resistance, TB.
Oh really? I had no idea that this was a problem.
LSN goes on location with LaFonda James, where she will report.
I'm LaFonda James, and I'm reporting in front of one of Kenya's most predominant hospitals. Many locals just wait outside here to get adequate health care. While this hospital gives many patients excellent health care, many of the other hospitals in sub-Saharan Africa are not able to do so because they are in unsuitable areas where medical facilitators give the wrong dosage of the two main TB drugs. Incorrect dosage of these drugs generally results in the patient becoming immune to them and not being able to cure the disease. This resistant strain of TB has been a major factor in the recent increase of TB rates. Back to you, Lee and Sarah.
Thank you, LaFonda.
While tuberculosis is definitely prevalent in the world, many people do not know the basic facts of the disease and how to prevent it. That is why education is an important factor in eliminating this fatal epidemic.
In addition to education, it is crucial for all individuals to receive a TB test, a test which is able to tell if the person currently holds the disease. Steps can be taken and usually more effective if the individual discovers they have the disease earlier. I actually heard some talk at the station that we were sponsoring a fundraiser that Sarah Traceman started.
What a wonderful role. This is why LSN introduces its TB Educate program, a fundraiser that will take place in a surrounding school. There will be a TB testing day at school where part of the day will be set aside to provide students with TB tests. Once the student has been tested, they will be given a pamphlet.
The pamphlet discusses the disease and how it can easily be prevented. Along with the pamphlets and TB tests, the school will have sponsors. Sponsors will consist of friends, parents, teachers, and possibly even an organization that is involved in the prevention and education of tuberculosis.
Each time a student took a TB test, a sponsor would donate a set amount of money. Once the fundraiser has ended, funds will go to an organization which aids people who are currently suffering from this disease, providing the organization with medical supplies to treat patients. The money raised could be a big help towards the fight against tuberculosis by giving organizations the supplies they need to provide others with TB tests and save lives.
Aren't there many organizations that viewers can help out with to not just eliminate this problem, but TB as a whole?
Why, yes, Lee, there are. Currently, WHO, the World Health Organization, is trying to start detecting cases in third world countries where the rate of TB is higher. Out of 22 countries, the WHO has been successful in detecting cases in 15 of these. Now WHO has teamed up with a global plan to stop TB and has new goals, which they hope to complete by 2014. This has been an LSN special report on tuberculosis. Coming up next, why are my toenails acting this way?
Symptoms were generally experienced were weight loss, fatigue, and fever.
I'm so sorry.
Since these are such common symptoms, he did not go see a doctor. When his case got more advanced, he began to regurgitate blood and sputum. Eventually, he was fine, and that is the biggest problem involving TB.
A drug-resistant TB.